I'd like to introduce myself. So my name is Jane Collinson. I've worked in public sector areas across health and care for the last 25 years. Specifically, 10 years of that was working in adult social care across both children and young adults and older adults in a wide range of roles. I've also got familial experience of social care provision, at times when elderly parents have had to utilise respite, home care provision, and I also employ a direct support worker for a family member. I applied to be an implementation support lead within DSCRs and social care because I'm keen to support the adoption of digital and care technologies, being aware of how this can support outcomes for people and benefits around the sector for service planning and service delivery. So, in terms of my role and how I work with system partners to implement and roll out digital social care's records and care technologies, we were trying to achieve this. This was our aspiration, the vision for the programme. So an adult social care system that makes best use of digital tools and technology to deliver better outcomes for people. So alongside of that, as a programme, we had a set of objectives that we needed to work with our partners. As you can see, the people at the heart of the care was the white paper that was published in December 2021, and it outlined how we was going to achieve this, and it also enabled us to have a pot of money called the Digital Transformation Fund. So, in terms of my role and how I worked with our system partners, I am a programme manager, but I'm part of the team that's called Implementation Support. And part of our role is to be regional leads with the system partners. So, we do things like we create the national guidance around the Digital Transformation Fund. We work with each of the integrated care boards and the integrated care systems to stand up implementation support teams. And we also manage the digital transformation budgets. Part of our role is to review, analyse and report on the use of our funding. It's all public sector money, so we've got to be auditable and we've got to be transparent. We also need to review risk and issues in terms of management, both regionally and on a national basis. And then as part of that, we create and manage a set of communities of practice across ICSs and regions. So what are we trying to striving to achieve? Partnership working by the use of effective communication, collaboration and the alignment of goals and objectives. And how do we do that? So as an individual, my role is all about building relationships with the people that I work with and through to achieve our objectives. So I started this role where, because of my adult social care background, I could really understand and discuss the context and talk to our local authority and ICS partners around, the challenges for workforce, recruitment, retention, demand and complexity, adult social care, financial pressures, and the variance in quality of care. And when we're trying to motivate organisations and people to utilise funding, we have to give them the context and say, how does the work that we're trying to achieve align with the work that they are trying to achieve? So improve outcomes for people, improve quality of care. How do we get people moving through the systems better? So from my perspective, I looked at how do we tie this funding into the Care Act 2014 and the local authorities' market shaping duties, where they're trying to make sure that care providers utilise tools and resources that's out there to provide high quality care and be innovative. So I aligned this funding to conversations around the adult social care challenges and the local authority responsibilities, as well as how do we get local authorities and integrated care systems and integrated care boards to work better together for the people that they serve. So, developing relationships and partnerships, you need to have clear, open communication, respect, trust. Yes. Yep, please do. Feel free to take a picture. Respect, trust, consensus of shared goals and effective partnerships. So, I started early conversations with some of my region colleagues, and they were very unenthusiastic, shall we say. They were concerned about the lack of resources, the potential lack of interest, and also just from a digital and care technology perspective, how little their local sector was perhaps interested. So it was just really, how do you talk and motivate and encourage partners to think about the bigger picture, which is essentially delivering high quality, safe care and improving outcomes for people, and say, well, let's just be pragmatic, let's be proportionate, don't go big, go small, just test it and let's see how we go. So essentially, communication was our main tool as individuals working with our system partners. So we created a lot of channels to create that sense of shared ownership, working towards objectives and goals where we could all support each other. And that's essentially what you're trying to do. It's building mutual relationships, mutual trust, and partnerships and collaboration. So in terms of the channels that either myself, my colleagues, or our programme developed in order to make this a success, we utilised Future NHS platform, which is a big platform where we can share, it's a workspace where we can share tools and resources, and also allow our system partners to talk to each other and share their local resources. We did regular one-to-one check-ins with our system partners to have conversations, to offer support, and to get them thinking outside of the box sometimes to overcome some of the challenges. We often sent out weekly what we called roundup messages, so key national updates, key information and resources that we wanted to share, and even kind of like regional information from other people that were doing the same job that they wanted to share with their peers. We also held regional peer-to-peer sessions. So when individuals and organisations are working on projects and programmes, it's really good to talk to people who are doing similar things, and even things where they're testing different types of technology, that they can share the challenges and the solutions that they've come up with to support that, and they all support each other. We always did a national DSC operational group where, again, we brought in guest speakers, or we had integrated care system partners come and share their good practice. And we also gave national updates as well. We often held, well, not often, but occasionally held extraordinary meetings where we had changes to communications around national guidance and or funding and or targets, just depending. And then what we essentially did as a team was support the implementation of communities of practice. So where we had 11 ICBs that had funded a specific type of care technology, we got them all together as a peer group. So again, they could talk about the challenges around that particular technology and the implementation and our ongoing support for that. Then a really big key part of our role is about supporting the identification and management of risks. So from our perspective as implementation leads and regional leads, we kind of had to look at the bigger picture when we were doing our planning and supporting systems. So we looked at how could we support strategic collaboration, and also how could we support ICBs and ICS system partnerships with their delivery around guidance and support. So you'll see from the slide that there's a number of different things that we did. So we essentially did the pre-plan engagement. So, it was to essentially drum up interest and get everybody talking about the objectives of the programme and what we were striving to achieve. Following on from that, we then held more localised launch sessions, and we outlined all the different templates that we were providing them with to make it as easy as possible so that they could submit both the 3-year strategic plan and annual 1-year implementation plans. And this also helped raise the profile so that they could share it within the system, and they could share resources out and get more system partners involved. Then, as we've talked about, we supported collaborative relationships. And then in addition, we looked at how could we get local authorities and integrated care boards and integrated care system partnerships to all work together. So part of that process was to say, well, we have to give the money to the ICBs, the integrated care boards, but the integrated care boards and system partnerships can make a decision who's going to lead on the delivery of the programme and who's going to receive the money and who's going to also engage and work with the care provider sector. We also outlined our national and regional objectives and sustainability outcomes. So we wanted all of our system partners to think about what we are doing is building digital foundations, but we want to see that extended and we want to understand how they would all work together going forward to embed and sustain what we were funding through the 3-year period. And then obviously we developed a whole raft of guidance and supports around how to fill in your plan templates, some good practice guidance, frequently asked questions, and we shared all of these via the various communication channels that we've outlined. And then we had regular communication and groups to get together. And then at a national toolkits and resources perspective, so the Digitising Social Care Programme, communications and resource and support team and other aspects, other work streams within the programme came up with a raft of toolkits and resources that could be really useful for operational planning, service delivery, but also to mitigate and manage the risks of the potential lack of engagement by the adult social care sector and providers. So, they did a range of media content, Twitter, etc. There's a newsletter, we have a website, so there's lots of places that people can go and find out information about the programme, its objectives and how to access funding, but also how to access or choose which solutions they wanted to consider for purchase. Again, all the different types of peer support. We also provided communications toolkits and a range of resources within that, from social media, templates for engagement sessions. We also, further along the line, provided short bite-sized videos of care providers who'd received funding and how they were benefiting from the use of a digital social care record and or care technologies. And in addition, the national programme also developed an assured solution framework, which was crucial because we've ranged from 8 assured solutions up to about 25 at one point on the list. And if you're a care provider trying to decide which solution's right for you, you need any help you can get. So luckily the national programme develops this decision support tool, and it's a few clicks and you could almost get a short list of the solutions that was available for you, and you could pick the ones that was perfect for your choice, for your needs. And then, of course, in another work stream, there was a range of resources that have been produced around career development and also what does good look like in terms of if you work in the sector, either as a provider, as a local authority, or as an ICB, you can utilise that as a resource to say, well, what do I want to do with my journey and how can I get there? And here's this What Good Looks Like toolkit, which will help you work your way through as a self-assessment framework, and you can get there. You can kind of plan your journey and how you're going to get there. And then we also commissioned the Digital Care Hub to provide masterclasses on a range of different topics that was very key to supporting and managing risks and in terms of a mitigation. And then at an ICB level, what we asked our partners to do is to kind of translate some of those national resources and toolkits into local resources. So, they had to also plan who was going to be involved with the engagement and the service delivery. They had to think about how they were going to do it, when they were going to do it, and who they were going to work through. They also had to identify their own targets. So we accepted that there would be variance in each ICB area, and as long as we got to 80% nationally, that was fine. And, we let them go away and baseline what they knew about digital and care technology use and try and early engagement with the sector. Then through that, they kind of like utilised all of those national resources and comms toolkits that we provided them, and they tweaked them to make them specific to their local area and what they were striving to achieve. And then we encouraged the connectivity between the system partners to talk about how could they involve local support organisations and care associations, national partners like Skills for Care, Care England, National Care Association, etc. How could we get all of these people working together regionally and locally to support these journeys? We had a lot of national support from CQC, who absolutely supported the sector go digital and utilise care technology to improve outcomes for people. And we occasionally were lucky enough to get CQC to come to face-to-face events in some regions. But essentially it was very much about how can health and care work together to deliver this. And our role was as facilitators, communicators, motivators, and sometimes negotiators. So we really had to do a lot of flexing, kind of like, which cap have I got on today and who am I talking to? What do they know? What part of the journey are they at? And how do we get them over each little hurdle to get to what we're trying to do? So in terms of impacts of what we did through our system partners, they've done the hard work, they've gone out there, they've engaged with the sector, they've supported the care providers to go digital and or use care technology. So essentially we've coded it a bit like a traffic light system. So there's a before, a during and after. So before we started this programme, the use of digital and care technologies was around 38-40% from a digital social care record. And what we knew in terms of care technology was there was some innovation, and it was really kind of like piecemeal and fragmented. So the last 3 years have seen through the engagement and kind of like motivation to aspire to do better that we've heard and seen through adult social care providers is we've managed to get to many more adult social care providers are now using care technology and or using multiple pieces of care technology to support individuals who are recipients of care and support. And in terms of our DSCR objectives, we are so close. Published, I think, is 75%, but informally we know there's a lot more going through that process, and we fully expect to see reaching our objectives quite soon. So fingers crossed. And then lastly, because my region is the Midlands, I just wanted to share some feedback from care providers who have accessed the fund and to kind of like talk about what difference it's made to them. So, I'm not going to read it out, but you can essentially see that all the feedback that we've got is really positive, and it's made such a difference to both adult social care providers in how they deliver care, how they improve outcomes for the people that they are responsible for, and then the recipients of this use of digital and care technology are again very positive wherever we work, but these are just from the Midlands. So thank you very much. Hope you enjoyed learning about how to be an implementation support lead. Thank you very much.